Welcome back to the PFC podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
And today I am with Andy. How are you doing again?
I'm with mine. Very good. How are you?
Our part 2 of our jungle medicine little series going on. So you can introduce yourself with the last one, so I think we can probably just jump into it. So in the last podcast, we talked about the environment and how awful and oppressive it can be if you're not prepared for it. So let's kind of just jump into now you're there. Like, what are the really common things that you really need to be prepared for?
Yeah, okay. Common things when we're looking at kind of specific injury patterns of the jungle are, I would say, kind of your heat illnesses, and then personal management of the feet, musculoskeletal conditions, and dermatological conditions are also kind of really common in there. What's also interesting as well is depending on how long you're in the jungle for, depends on kind of what conditions you're going to see. If you're in the jungle for longer periods of time, so say maybe 3 weeks onwards or 4 weeks onwards, that's when you're potentially going to see more of the tropical diseases appear. Just because some of these diseases, or a lot of these diseases, are incubation periods. And so it takes a bit of time for the condition to appear or presents itself to you. Well, you kind of gotta go back to the ones that we do concern ourselves with. That's in the jungle, so kind of exertional heat illness. Depending on the activities you're doing in the jungle, like if you're in a military kind of situation where you're doing operations in there, you're patrolling out every day, then obviously your risk of getting exertional heat illness is greatly increased. The issue that we have is it doesn't really cool down in the jungle. So to start to cool your patient down is difficult. And so all we can kind of do then is just stick to the basics initially. So they'll stop the activity, get the person in shade. If you're out in the sun, strip them, their clothes down to their underwear and then soak them and then fan them down. The first couple of those, they're pretty simple, but the soak and fan, this is where we need to kind of look at what we're doing, because it really does make a difference whether you just pour a canteen or water bottle all over your patient to cool them down versus having I carry a small water bottle about this big, it just fits in my pack, and then using a spray water bottle, because that kind of encourages evaporation, which is a more effective cooling than trying to pour a lot of water over there. Obviously, water is a resource. It's normally an easy resource to get in the jungle. But if you're higher up in the mountains of the jungle, then it becomes more difficult to acquire. So therefore, you might not want to pour 3, 4, 5, 6 liters over your patient, which isn't going to last long at all, versus spraying a water bottle. And then fanning them down. I always kind of encourage everyone to carry a small plastic sheet. So you used to get them in like ammunition tins. You get the plastic you buy in the ammunition tins, or a small sheet of plastic, then using that to kind of fan them down. Get 3 or as many people as you can around them, someone spraying and then just fanning them down. That normally works really well. You can also kind of put them into the river. Now, obviously, you need to be careful doing this. You don't want to just launch them in and kind of hope for the best. It's under control, 2 or 3 people holding them in, head facing downstream, kind of just letting the water run over their bodies. The smaller, you only need somebody that's small enough to just submerge the body. Okay? And you can avoid going to the main river system where it's got a larger flow. So that's probably advisable for safety reasons. And again, you don't want a load of guys on the edge of the river if you're in crop-infested territory or caiman-infested territory or water that's not very clean, which might have its own tropical diseases in there. So think about how you're going to do this before you get there. What's around you? What do you have? what's the skill, what's the drill, get everyone involved, and kind of then what's the plan? Let's say, throughout your patient recovers within 30 minutes. Okay, that's good. Like, you need to keep an eye on them. They could probably continue. But your patient's still pretty sick after 30 minutes, then that's them out. Right? You need to call in a medevac. How are you going to do that, whether it's through the river or through an air asset? That person's going to go, because they are then at more risk of kind of reacquiring a heat illness if you kind of push them on. And not only that, if that person's got a heat illness, then what's the rest of your team doing? Like, how they? Yes, that's kind of some down low on the heat in the jungle.
I mean, would you pick it with some of these interventions in mind? It's 9,000 degrees here. Maybe we should be closer to a water, like a stream or something like that, because the odds are pretty good that somebody's going to get hot, and we're going to have to do something about it.
Yeah, absolutely. It's definitely a consideration. So I think with the medical stuff, consideration of where you locate your camp is important, because you want to be close enough to the stream to acquire water. And because obviously we're all drinking more water than what we normally would as well, because of the heat and humidity. So it's important, but then at the same time, you don't want to be too close to the water, because if you get a flash flood further upstream, and then you kind of wipe out where you are. And I've been on several occasions set up camp in an area. It's then rained, and then a river has appeared out of nowhere underneath the hammocks, or like going straight through the middle of the camp. And it's comical, or you're like, you would never guess that. So sometimes it's a bit of luck as to kind of where you're going to place your camp when it rains. Like the medical considerations for where you go are pretty important. And it's the same with, like, where if you're then by the river, that's where you're getting your water from. And where are you going to place the latrines? Where's the pea tree? Where are you going to dig down? What's the routine? That needs to be done well in advance.
So you're going to have knowledge of, like, this is where we're going, this will be the area. Would you use, Google Earth or something like that to try and pick out, like, hey, this general area would probably be a good spot for, camp first night. This would be a good spot for camp second night, type thing.
Yeah, I have a plan in A and B when we do this. Again, normal in jungle environments, the mapping for those areas are normally relatively poor. I think again, if you're in the military, you normally have access to your own military and then partner forces and military mapping, which is normally pretty good. If you're lost, then that's not a problem. So you can go and access these maps through geographic societies. So the World Geographic Society, and a lot of the governments as well, especially if it's kind of science related and beneficial to that country that you're in. If you ask their government, or even their military, if you're not military, if you can have access to mapping of certain areas, sometimes they are willing to kind of hand off those maps to you. But again, this all have to be done well in advance. Having a plan, an A and a B. What if, like I said, what if a river starts running through our camp? Where are we gonna? If we're not being attacked and we're not under direct threat as such, but everyone's going to be at 10,000 feet, collecting their gear. Everyone needs to know that we're going to, like, the RV point is like west, like 200 meters, right, so that everyone can, like, meet up there, because it's going to be dark as well. I'm going to lose kit, equipment, people. So, have that plan in place.
Exertion, also, just hydration and nutrition are, I think, and acclimatization, like all the basic stuff you should have down before you go. But just maintaining that can be pretty difficult, because, like, you're sweating enormous amount. The heat doesn't let you cool down.
Yeah, and this is the problem. Like, it's another constant battle that you're fighting, as well as you're trying to be a good medic. You're trying to maintain your own personal administration. You're trying to eat and drink enough to survive and stay cool. And then you're then looking at your team, and then you're like, well, I need to make sure that they are eating enough and drinking enough. I know you probably say they're big boys and girls, they should look after themselves, but ultimately, if they don't, where are they coming? They're coming to you, man. So it's kind of just making sure reducing your workload by looking at everyone else is kind of the key. So I think with the food, the nutrition and the water, it's education that needs to be done beforehand. And I think a lot of the stuff that we're talking about is a lot of this can be done beforehand. Like, where are we going to? What are the threats? What's our SOPs? Good solid SOPs as to how you tackle all these things. And you'll do way better than kind of probably most outfits I've seen.
So other than the extreme heat and humidity causing, some kind of heat injury, I guess what are some other common, like, I'm imagining like rolling your ankle, rashes, getting stung, getting poked with stuff.
Yeah, so like MSK, it's big, like musculoskeletal injuries, especially at the lower limbs, were probably one of the biggest issues I had, especially if you're carrying patrol parts or if we're doing a heavy move from one base camp to another base camp. Some of these packs, because of the kit you've got and a lot of the stuff is wet, it's quite heavy. The ground's always kind of undulating terrain with no set parts. Yeah, knowing how to kind of strap an ankle, strap a knee is essential. And using the correct stuff. So get yourself some decent physio tape or cane tape or rock tape, whatever you want to call it, and knowing how to do like a bomber's strap on someone's ankle. Because again, it's sometimes like if someone rolls their ankle, do you want to call in an airframe to Kaziback them? Or
not particularly. No.
Exactly, it's just kind of there. Well, you're then in that constant battle of trying to keep the people in the jungle. A lot of them, they want to be there anyway. You just got to you're fighting to keep them in there. So giving them with the correct kind of movement to do exercises, to do the correct drugs at the correct time. So it's not just blasting them away with NSAID straight away. Then they heal. Ice packs, like no one has ice packs in the jungle, which is kind of a good thing. So let the heat do its thing, let your body do its thing. And then kind of other things that kind of come along with that is all your blisters and blister management, nicks and cuts. They can start to become problematic, especially over time, especially if you're kind of soaking wet. You get like degradation of the skin, and people get like webbing sores. And normally it's like we've got webbing on us and it's kind of rubbing against us. I've seen people get sores just on the cuffs or from their sleeves because their skin's so wet and moist and soft that just cuffs rubbing on them and their trouser waistband rubbing on them has caused like quite debilitating injuries where it's quite painful for them. So yeah, kind of just being aware of all that. Kind of just make sure you do a full body scan every night, like yourself and a buddy. As you're looking at all the places where you're going to find leeches and ticks and all those other fun things.
Hygiene station, something like that, so they can get themselves cleaned off.
Yeah, I mean, I'm pretty lucky because we will have a stretcher. So what I'll do is I'll have my hammock in one place and then with a tarp and a stretcher underneath, or at least kind of logs that can hold a stretcher. I'll have it kind of then, and the guys as they're coming through, and the first thing I'll say, hey, listen, like I'll be kind of relatively close to the main eating area or communal area. We always try and have a communal area, and I'll be close to there so the guys can walk on through and get easy access to me. Okay, try to be a bit medic and just be ready for them. I'm always last at food in the morning, and I'm always kind of last to get my food at night, and I'm always one of the last up because I'm just making sure that the guys are good, the guys are ready, they've got everything they need, and then me being the medic, I've done all my stuff, I'm looked after myself. And then, I can square everyone else away. And Because I think you expect the people to know how to manage their own blisters, how to manage their own kind of ailments. But the thing is, with the jungle, it's different, right? These things might not be so obvious in the jungle, and they may struggle to have the correct kit and equipment to. If the kid gets wet, the dressings are going to just fall apart, roll over, and then essentially they're just going to make themselves, or they're going to create more injuries, larger rashes on the back of their feet. So again, they probably, do more education on how to manage them. I know, guys, hey, I know how you know how to dress a blister. Well, actually, what I'm going to show you is how to dress a blister for the jungle that's actually going to stay in the feet even if it gets wet. And that may be like using like K-tape wrapped around the whole ankle at the front instead of just the strip around the back of the heel, for example, just so it doesn't kind of peel off. Also, if you have sticky edges, then getting like talcum powder, dabbing it on all the sticky edges of the tape so it doesn't roll over, it is another kind of tip that I found is really useful in the jungle. And then just management of the feet, like just talcing your feet every morning and every evening. Which again, it's not normally, especially like it's not in my routine when I'm at home to talc my feet in the morning and the evening. Hey, some people do it. That's cool. But like, it's that mindset of like, you need to do this, guys. This is like, do you brush your teeth every morning? Yes. Okay. You need to talc your feet every morning too. Yeah, getting on top of that for the guys, it is pretty essential.
Like a wet gear, dry gear. So wet when you're out and about, having a dry set in the evening.
Yeah.
I guess what and why are you doing that?
Yeah, so this is called a kind of wet and dry routine. And essentially it's your wet kit is your working kit. It's what you're using throughout the day. Because it will rain, and even if it's not raining, it's still relatively wet, or maybe you have to kind of patrol through rivers. So you've got kind of wet kit. Having wet kit for short periods of time, it's not normally a problem. It's not an issue at all. But having it on for kind of days on end, it will start to kind of break down your skin. It'll kind of get to you. You start to get rashes, and you start to get stuff appearing on you that you've never seen before. And to be honest, sometimes as a medic, I'm like, I've never seen that before. Taking your wet kit off of an evening, right? Giving yourself an opportunity to dry. But what's also important is like of an evening, being close to the river, like we said before, it gives the guys an opportunity to get in the river and have a wash. Because the likelihood is that you may have had some cream on you all day. You've probably laced yourself in feet. They're trying to stop any ticks, leeches, or nasties getting on you. You don't want that stuff on constantly on your body. So I think the best thing to do is to get in the river, give yourself a good wash, and scrub yourself, check yourself over, get your body to check you over too. Say like, hey, am I clean? On the back and under armpits and everywhere else. And then once you've had the wash, then again, back in dry kit on. That just kind of gives that chance to rest and recuperate, gives your body a chance to kind of recuperate in the evening, because operations don't tend to happen as soon as it gets dark. As soon as it's dark or it's dusk, that's kind of right. We're stopping operations. We're going to move in. We're going to go to our center kind of base camp communal area. Everyone's going to get some food, water, have a wash, get dry clothing on. And then again, then that's your kit to then sleep dry in your hammock that evening. Because obviously you can do kind of the old cold routine. You're not going to last more than 3 days doing that cold, wet, sleeping on the floor routine in the jungle. I've seen guys after one night just fall apart. Just from being bitten and their skin starts to pull off. So yeah, that's kind of why we do the wet and dry. It's essential. It's for kind of maintenance of your own body, and probably mentally as well. It's a look forward. Like it's a look forward to getting into that dry, warm kit on in the hammock, and you get a decent amount of sleep. Obviously, the only problem there then is this the next morning. You then have to get your wet kit back on. And it's normally the same wet kit. Like I said, in the jungle, you normally have 2 sets of kit just because of carrying the weight, and the dry kit and the wet kit.
Okay.
And that's it.
Wet kit at night, do you just put it out on a line to dry, or do you put it in a bag to keep all the crawlies out of it?
Yes, and keep it off the floor. You can put it out on a line if you want. I think it depends, because stuff doesn't normally dry in the jungle because of the humidity. It will stop something being dripping wet to just being wet. Personal preference, doesn't matter. If you have kind of the problem is if you have an opportunity to say dry it on a HLS, or dry it in an open bit of land, or where there's a river and you've got the sun coming down, that's normally in the daytime where you need your wet kit on. So again, I know guys, a lot of guys that do take 3 sets of kit. So after probably like 3 or 4 days, what they'll do is their 3rd set kit, they'll break it out, and then their original wet kit they'll throw out in the sun for a day or even 2 days to try and dry out, to then bring it back into circulation and kind of give yourself a bit of respite. Because you do, you kind of have a load of days where you're actually dry. Depends what's going on. Obviously, your super dry kit is for evenings only, for literally being to go and to get food, and then to go and get in your hammock. It shouldn't be used for anything else.
So, we just went over heat. Now we're getting, just getting bit and stuck with various plants and things like that. Just keeping your body clean probably knock down the majority of the problems dealing with that. But some of those insects and animals, when they bite you, they also envenomate you. How can you even have the different?
Yeah, again, some of this comes down to kind of doing a bit of education for yourself and the guys, and finding the information as to kind of what creepy crawlies are in that area. Again, when we're talking snakes, and obviously the gold standard, there's obviously the JTS CPG 81, which is the Global Snake Envenomation Management guidelines, which are by far the best snake guidelines I've ever seen. And they're the ones that go to that I use them in a civilian context and in a military context. And it's just it's not often you get a guideline that's quite readable. And this is one of the few that I think is readable. Like you can pick it up. You can just be a normal, you can just be a private from the ground, pick that up and go, I can read this and understand it. So yeah, that's the gold standard. Looking at kind of the CDC, what information they have for that area, the WHO, what information they have for that area. And then just snake management is a whole completely different subject. Obviously, I'm not going to go into it too in depth but are there species of snake in your area? Are they vipers or are they elapids? Depending on what part of the world you're in, or are you in a place where there's both? Which is kind of common in most jungles. Yeah. And then it's a case of kind of, while becoming a herpetologist, is kind of looking at what do these snakes look like. And normally educating the guys, because a lot of the time as the medic, you've seen it, it's already happened. Whereas the guys, if you say, okay, look for the head, look for the shape, look for colours. And then maybe if you just have a laminated sheet of the most common kind of snakes, okay, they're getting ptosis, then it's probably an elapid bite. And then you can kind of do your management protocols from there, which is really useful. So that's kind of snakes. They tend to be the easy one, just because there is a lot of information out there. Other things that can kind of cash you out are kind of the tarantulas and the spiders and the scorpions. They're hit and miss. They don't tend to kill people often, which is good, I suppose. But they can cause kind of worrying symptoms and presentations that are kind of not good, especially with the tarantulas. Because I know you can tell the guys all day long, don't go listing logs looking for these things. They're going to do it anyway, right? But you've done your bit, right? So with chancellors, again, one of their main defences is they rub the hairs down on their abdomens, and they're kind of the irritating urticarial hairs. So when the guys get to poke them with the stapler to pick them up, it's like, look, chancellors, they don't bite me. They'll rub their abdomen, these hairs go up your nose, into your eyes, and then you've just got these, it's like this so painful, like irritating hairs all over their face. And there's not too much you can do. Aside from kind of you can get like gorilla tape or masking tape, whatever you want to call it, with the sticky side out, wrap it around your hand and kind of dab the areas. And what that does is it kind of pulls off the irritating hairs onto the tape. So that's a good thing to use. I've used that before as well for hairy caterpillars. So that's saying why it works for hairy caterpillars. A guy come down and he's like rubbing himself, and he's like, "Oh, maybe there's something in here," and then this squished caterpillar like fell out of his top, and he just I thought he was all over the place. I was trying right tape, dabbed him down, and he had an obvious rash coming down his body here. When he said that doing the tape, he said the pain almost went away within a couple of minutes. Just because we kind of captured a lot of those hairs. So, yeah, just having little tips like that are useful. Other problems that I kind of see out there, there's a lot of plants out there and trees that contain toxic substances on them. So it's normally like a waxy residue, or whether it's in the sap or even just on the leaves. They're known under different names. One of the more common ones is like a poisonwood tree. And it has a waxy sap. If it gets on you, can cause severe irritation and even blisters. And the problem with that is if you burst the blisters, the fluid within the blister contains the sap still. So it'll just end up spreading down. So the fluid from that blister goes onto normal skin. It will then create more blisters. And it's quite toxic and kind of debilitating. But there's not much you can do with that. It's kind of just wash it off as best as you can. But I have had actually had to Kazivac someone who's had that, who was it was on a training exercise. They had a cold crash move where middle of night, woken up, crashed out, and then they have to sleep in the jungle with just what they've got on them, basically just weaponing yourself for the whole night. He found a nice tree to cuddle up under. It absolutely rained all night, and the waxy residue from the tree literally covered him, his whole body. So from the tree, his neck, all the way down to his ankles was just this horrific, itchy rash. And then again, there was not much we could do for that. It was just, it got that bad. We even considered kind of giving him ketamine.
Oh, really?
To kind of to kind of sedate him, because he was just irritable and agitated, and he was almost unworkable, and he was in a lot of pain. And you're like, wow, I've never thought I'd have to do this for a rash, right? Like, this is crazy. So yeah, we called in, we just said we're gonna have to get a medevac. And they're like, what's it for? And we were like, it's for a rash. And they were like, are you joking? I was like, no, like, you gotta come and get this guy. Like, he needs, probably to get bathed properly. And we were just like, we don't know what other management he needs. But yeah, we sent him out, and it's just from a tree. And it was just like, wow. That's the first time I've seen it. And it was pretty scary. Just thought how he can just be so debilitated from that.
IV, well, especially if they've got it all over.
Well, this was it. You kind of looked at those as options. Again, we said put the cream on him, but it was like this whole body, like, you know, a couple of tubes of Pinacol or something, like, well, can we then set up an IV? And it was like, okay, well, let's set one up anyway, because obviously we're just going to kind of give him some of other drugs to kind of help with it. But yeah, he was eventually fine. Took him a couple of days. The rash died down those days. But yeah, it was just like, that's crazy. Yeah. I do have pictures of it, like with it pre-horrific as well, yeah. So anyone that's like, if anyone's super interested, then yeah, get in touch. I'll share the pictures. Yeah. And like, scorpions things, obviously depending kind of where you are in the world, some of them are kind of, you'll just get throbbing pain for a couple of hours, all the way up to kind of 24 hours, 48 hours, and like slightly being delirious. I remember one of the guys I was with, we kept hold of him, we couldn't get him out. He was actually, I thought he was fine, he was stable. He was just kind of drunk. He was just slightly delirious, just acting slightly drunk. He just kept an eye on him, kept him at the base camp, just for like 24 hours. And yeah, I mean, it was an obvious scorpion sting. He said he saw it, and it just had this one single kind of puncture wound and a big like erythema mark around his thigh. And yeah, he was fine. But yeah, it is kind of, what else? Because when you associate stings and venom, you always think the worst and go, well, is this like a snake bite venom where we could die from it?
Yeah.
Well, most of the time, it's not. It would be, especially kind of like a black forest scorpion, which tends to be one of the more common scorpions that you get out there. Well,
So the straight, allergic reaction is probably really common because, you're going into an environment that you're not necessarily from or used to. So I imagine, people can be allergic to the craziest stuff to begin with.
yeah, well, that and bees and wasp stings. I said, and the animals, they, especially in the jungle, a lot of them, apart from like the monkeys and that they're not scared of you. Right? You're not someone that's there. They're not threatened by you. Times I've had guys patrol through or kind of in training doing kind of like a shooting lane and then run straight through a hornet's nest or a wasp nest or a bee's nest. And then they're just like, wow, chasing, and I've been stung like 20 times, 30 times. And that's when you're like, okay, I'm waiting for it. I'm waiting for the anaphylaxis. I do. I have enough like anaphylaxis kit to kind of management. And that's kind of probably then brings you around to, but we all know that people can get kind of refractory anaphylaxis, and in the jungle, it's not easy to just go away and acquire more adrenaline. So yeah, doing the old bit, knowing how to set up like a dirty epi and kind of manage that if they're getting a continuous kind of reaction. And again, other things, knowing how to crack open an EpiPen to get more dosages. Obviously, I don't encourage that, but it's there if you're really stuck. It's kind of also useful because you got to realize that you may not get these guys out. Like a lot of the times I've been in the jungle, there's no night flying. Yeah. And that's where I probably had to hold a lot of casualties for long periods of time, is in the jungle, where it's happened. Normally the stuff happens when the guys have been up patrolling all day, they're fine, they get in their dry gear, and then they're walking around, it's dusk. Then the creepy crawlies come out, or they're just not paying attention. They're having a laugh. They're walking around in, say, trainers or loose footwear because they don't want their wet boots on. And then they kind of roll over and have a fracture dislocation ankle. It's faces scorpion sting, and let's say you're concerned. No one's coming to get them till light the next day. So you're holding those patients. So kind of, it can get tricky at times, but then it really does test you. So if you have to hold someone who's got anaphylaxis, you can't get them out because they've been stung with an evening, then you're just gonna have to sit on it and know how to be prolonged field care, essentially, especially if there's a big sick. There's no one coming no matter what. And I think that comes down to that if I'm going to, normally a lot of areas you go to, prolonged field care kit is an option. You've got a prolonged field kit packed. It's kind of there, ready to go. It's normally kind of based on a platform. So that's there we need it. Whereas I think in the jungle, it needs to be in your kit. You will, it's when the risk is the highest, right? Is keeping someone in the jungle overnight. So therefore you need that extra prolonged field care kit. And then how to kind of water to someone as well. So you're lobbing a bag kind of thing, but making sure you've got everything in there, and how to, even despite all your electronics like an MF capnograph, pulse ox, and even an ultrasound, if you train to, ultrasound has become a lot more common now. They're easy, accessible. The training is relatively easy. If you're just doing, say, like an EFAST. And yeah, I think it's going to be, and it's just a good tool when you've got a trauma patient and you're sitting on them and you're like, okay, right, how sick is my patient? And then you can do a quick EFAST, or continuous EFASTs over time to kind of build up that picture, to see, because again, I say there's no knife lying, but I'm pretty sure that if you did a consult and said this guy will not make it till the morning, and it's one of your guys, then they may say, okay, let's accept this risk. Let's actually go and try and do a nighttime winch. So yeah, man. So yeah, I think having those tools in your bag to kind of be able to pass on that information is useful. And then all your paperwork needs to be laminated, like the tying of that. Like, I laminate all my cardboard plaque over here on my side, and that's my kind of my wet environment, outdoor environment paperwork, where I use a permanent marker to write on all my laminated stuff. Yeah.
So I mean, kind of speaking of evac, like there's not just open ground everywhere. You're talking, probably, single, double, triple canopy jungle. So there's not going to be lots of places where a helicopter can land or roads are nearby. So, I mean, I guess how do you manage? Obviously, you pre-plan areas, but like any good plan, nobody thinks anything will go wrong, and so your planned evacuation. Let's say even if you happen to have open ground, 5 kilometers away, 7 kilometers away, it can be untenable when you're actually carrying somebody.
Yeah, so I think the ultimate goal here is no matter what you do, what you want to try and prevent is having a stretcher casualty in a jungle. In an operational context, this is an absolute disaster, just because the amount of resources required to carry a casualty who's in a stretcher through the jungle, it is immense, right? It's a very difficult thing. So ultimately, it becomes a complex / technical rescue where you're going on undulating terrain. You're probably going to need rope systems in elements in part of the jungle. Often you're going up a steep slope. You just don't want kind of four dudes on a stretcher trying to carry this guy up, because if one slips, you're all tumbling down that hill. So therefore, you need to set up a technical rope rescue kind of system where you can kind of hold someone, and then making sure that you got the correct stretcher for the jungle. This is difficult, right? Because ideally, I've just said in the jungle, if you're a stretcher casualty, it becomes a technical rescue. Well, there's not many technical rescue stretchers that I know that are small and light. So the problem there, okay, how can you secure your patient to do some form of a technical rescue if they're in a Talon 2 or if they're in an R-lift? It's difficult because yes, we would love, say, like a sked. Like that, that'd be great. We throw them in a sked, strap them in. We've got all these anchor points. We can do vertical, horizontal, flip it round, upside down, whatever you want to do. But who's carrying a sked in a jungle? And no one's. And so actually, looking at the stretcher you are carrying, do you have a harness system that you can actually fix a patient into to go up steep terrain? Like, how are you going to do that? Do you have the kit? Try it before you go there. Like, try it. What kind of resources then do you have to get you out? Like, where are you going? Are you going to a river because you've got ribs available? Does that stretcher fit on the rib? Where does it fit on the rib? Like, have you looked at it? How do you secure it to the rib? It's quite important, right? Those ribs start kicking up some waves, and then they get a bit of a bounce, and next thing your patient bounces off into the water. It's not cool. So again, with linear frames, a lot of the time, because of the jungle canopy, we tend to use small framed aircraft. like old school Bell type aircraft where to try and get a stretcher in there may be difficult. So you may be able to say, okay, cool, all we can do is get a Talon 2 with the handles banged in, just about squeezes in the helicopter. Anyway, cool, right? You know it squeezes in. How's it then going to secure to the floor? Because a lot of the time these airframes coming to get you are not going to be medically kind of dedicated assets. They're just going to be a transport aircraft where you're just going to go. So again, that needs to be looked at beforehand. And then one of the other things that kind of, as part of orders, if you're going out patrolling, like you've got all these guys patrolling out doing their business, say to them, if you come across a gap in the canopy that you think we can winch down or through, cater on the GPS, and then send it back in to the jungle base camp. And then I'll sit there with the commander and we'll plot these points of when over the next few weeks, where we get a casualty, we say, oh, the guys like they have applied a hole in the canopy, they're like 1k away from that location, and then pay and go there. So it's a dynamic kind of process.
Like anything, especially, any boats, any kind of aircraft, prior planning, prior coordination, just get hold of it, try it out, and just see how it works before you just assume that, my plan is going to work, it'll be just fine. And that's usually when you find the weak point.
Yeah, that's it. Like you need to kind of iron out all those chinks in your armor. All these skills and drills, pretty much everything we've talked about is kind of like, you need to do that prior planning. You need to absolutely nail it down, look at every single scenario, and act it out, right? A truly good team will act out all these things before they go, and not just kind of talk about it around the table. It's like, hey, let's get the stretcher out. Let's attach someone to it in a harness. Let's go down and see the boat guys who've got the rib that we're using, and let's attach the stretcher with someone in the harness to the boat. And tell the boat guys, and they'll know like what to do. They know what you can lash the stretcher to. They maybe even done it before. So I think doing that, but for kind of every aspect, it would be kind of the gold standard of governing the jungle. Because ultimately, like, as you probably gathered already, it's complex on so many kind of levels, right? The jungle will absolutely eat you alive. And like I said, the jungle's neutral. It doesn't decide, it just goes, right, that's you're done. Yeah, it doesn't discriminate. You try to do that you want, but ultimately, in the end, but the jungle wants you, it's going to take you. But you can do a lot beforehand to kind of prevent all that in the first place.
Other kind of tips or tricks that you need to talk about?
I think it's just educating yourself on what the risks are and what's going to be out there. And I think you're only as good as the knowledge that you know of that area. And I'll be honest with you, if I get told, hey, Andy, we're going to Borneo, or we're going to this part of Borneo, I honestly become a nerd on that area. Like, I will go into the resources, I will read books. I've actually been known, I've been to tropical medicine, like universities, and just spoken to someone and said, hey, like, you're the expert in this area, can you tell me where I might see more? I have just, really nerd out on it, and just, because the more that you know about the animals, the plants, the tropical diseases in that area, then the better equipped you're going to be. Because just knowing your normal TTRIC and having a good knowledge of PSC is probably not enough. Right? I think a lot of what you're going to see is potentially going to be top there. It's going to be primary healthcare, mental health. You're going to be doing environmental health medicine in with command, like supporting what they're doing. And normally there's either like yourself and a doc. It's a lot to know. Yeah, and you can kind of write as much down as you can. obviously laminate it, of course, because everything will get worse. And then just take this information with you. Like, there's good books out there that I've used that kind of done me good.
Go on, what would it be?
Oh man, I think it's right here. Is a sec. So I got this one. I'm not affiliated at all with this, by the way, but it's the Oxford Handbook of Expedition and Wilderness Medicine. Right, as being my go-to. And the book itself it covers everything from trauma all the way through primary healthcare, and all the way into kind of the more uncommon things that you may see. I think it's on the 3rd edition now, so that's the first one. I've got the 3rd one upstairs. It's actually packed in my bag, like kind of good to go. I think that's my go-to book, if I can recommend one.
Well, thank you, Andy. I really appreciate you walking me through this.
No, man, it's been an absolute pleasure.
That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. Check out our free downloads and a ton of other helpful information. Grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC podcast, out.